Natalie Kelleher. I'm going to perform a basic IV insertion. First, I'm going to be in my nursing station. I'm going to have my MAR. I'm going to gather all my supplies. I'm going to gather an IV extension, a tourniquet, a label, some alcohol pads, saline, check for the expiration date, the date, my needle, my 10 ml syringe, tape, pen, and gloves. Now that I have all of my supplies, I'm going to look over the MAR, read about the patient, check for allergies, history. Now I'm going to take 3 ml of saline. I'm going to inject it with 3 ml air first.
Do you want me to look up the first stuff and side effects? Do we need to know that?
Yeah, the side effects.
Pull back 3 ml.
The common uses, nursing implications.
Now I'm going to dispose the needle in the sharps container. Next, I'm going to take my IV extension, attach the syringe, and I'm going to unclamp,
To
Prime
reduce
it.
the development of drug-resistant bacteria
okay,
as an
Reclamp.
antibacterial drug, blah, blah, blah. Is there any side effects here? I don't know my drug book, I lost mine.
set it to the side.
Yeah.
I'm going to look over the MAR one more time, make sure everything's correct. I chose a 20 gauge needle, just in case the patient needs blood transfusion or medication. Now that I have all of my supplies, everything matches up with the MAR, I'm going to enter the patient's room. The first thing I'm going to do is identify the patient with name and date of birth, compare it to the MAR. He's the correct patient. I'm going to perform hand hygiene. Next, I'm going to ask the patient what's his dominant hand, and I'm going to select the non-dominant arm for my IV insertion. I'll also ask him if he's had any mastectomies or fistulas, if he has any allergies.
Yeah, she looked at the bag and then
Everything's okay. Next, I'm going to palpate and look for my vein. I'm going to be looking for a bouncy, resilient vein.
Didn't she say 100?
Once I located the spot, I'm going to apply the tourniquet about 4 to 6 inches distal from the site I chose. I also want to choose the most distal site for my IV insertion. Okay. I'm going to apply
Is that what's on there?
alcohol onto the site, inner outer circular motion. As I let that dry, I'm going to apply my gloves. As I apply the gloves, I'm going to explain the procedure to the patient, tell them what to expect.
Contains us, I think that's where she got.
Next, I'm going to take my needle. I'm going to apply pressure to the vein I selected, opposite direction that I'm going to insert. I'm going to go to 15-degree angle, bevel up. I'm going to explain to the patient who's going to feel a prick. I'm going to insert. I see flashback. Lower. Slowly insert the catheter.
So then you do 100 divided by 60 times 10. So then you do.
Okay. Apply pressure, release the tourniquet. Dispose the needle into the sharps container. And I'm going to attach the extension, stabilizing. Now that it's attached, I'm going to release the clamp. I'm going to aspirate. Normal patient, I would have blood return. Once I see my blood return, I'm going to do the push stop method. After I do that, I'm going to remove. I'm going to reclamp this.
So yeah, we label it, remember
I'm going to ask the patient if he has any extreme discomfort. I'm going to look for swelling and redness. If everything seems to be okay, I'm going to apply the Tegaderm.
Oh, we're not doing this one, we're doing the wrong one. Okay, we should be doing this one first. Because this is a piggyback. That's why.
Which one should I think the mini bag's the piggyback, this one. The piggyback's last.
So this is the piggyback, cause why does it say anything about primary two and on this?
Let's just assume the primary two is running.
I'm going to peel this off.
This is just for administering med, and then I think we do Smith.
So yeah, this one is first.
Yeah.
Now I'm going to label my initials, the date, the gauge of the needle. Apply this on the Tegaderm. Then I'm going to take my tape.
So this one is first, this one?
Yeah,
And piggyback.
mini bag is a piggyback, it's the same thing. The mini bag is the one that's usually the piggyback.
So one, this one.
Apply one on the
It's a
top,
primary.
This one, not this one. This one.
one on the bottom.
Is it?
Secure it.
If I'm wrong.
I don't know, I see.
Piggyback should be second because.
Then I can also
remember she showed
make
me
sure
one
this is
that
out of the
first,
patient's way
but the piggyback.
and apply another piece of tape
Right.
on the
It's only
tube
administered
to
medication
stabilize
first.
the IV.
We need to put it in the bag, remember?
Now I'm going to
So it's nothing about.
check the MAR, make sure my orders are completely accurate. I'll return in about an hour to ask the patient if he has any discomfort,
That's what I'm saying.
and that's how you do a basic IV insertion. After, I'm also going to chart, of course, chart and document the site, the location where I put the IV, the gauge, the date, client's name, my name, how many times it took me to insert the catheter,
Not this one.
the IV,
See,
and
this one says.
that's about it.